Hello, my name is Lynn Roser, and I'm the Infection Prevention Nurse Consultant in the HAI Prevention Program for the Kentucky Department for Public Health. My co-presenter is Shelley Wood, who is a nurse consultant in the Infectious Disease Branch. Together we're going to present a little program on the role of the local health department personnel in triaging patients with suspected Ebola virus disease, and as well as the use of PPE in that setting. Before we begin, let me just review some of the objectives for today. After the presentation, you will be able to understand the role of local health department staff in the identification and isolation of suspected Ebola patients in the local health department setting. You will also be able to understand standard and transmission-based precautions to prevent healthcare-associated infections. You will understand the components of personal protective equipment, also known as PPE for local health department settings, and understand the components of PPE for surveillance and monitoring activities. And lastly, demonstrate the proper procedures for donning and doffing PPE in that setting. Let me just begin by telling you a little bit about Ebola virus disease and its history. It was first recognized near the Ebola River Valley during an outbreak in Zaire, now the Democratic Republic of Congo, in 1976. Since that time, there have been sporadic outbreaks which occur typically in the sub-Saharan Africa regions. Mortality rates from Ebola virus disease have a wide range, and you can see in the literature it ranges from 25 to 90%. This is usually a result of how quickly people can seek health care and how quickly they recognize that they may have a problem. Between 1976 and 2013, historically fewer than 1,000 people per year have been infected. That has changed with the outbreak of 2014. This outbreak in 2014 has been the largest to date. The currently affected countries are Guinea, Sierra Leone, Liberia, and Mali. Mali is approaching a point where it will probably be taken off countries affected. Each country has to go for 2 periods, which equals about 42 days, in order to be taken off the list. A smaller unrelated outbreak, which is now over, occurred in the Democratic Republic of Congo in Central Africa. It was not considered part of the 2014 outbreak, but I mention it just because you will see it on CDC's website. Here is a map that shows the current outbreak. You can see all the countries are highlighted in a gold to orange. Here in Mali is this little area. 8 people were infected. It has not changed in weeks. So we feel like that outbreak is under control, but I just wanted you to see this map so that you can see how widespread this is in that little portion of Western Africa. This particular slide I wanted to put up just to discuss the ecology and transmission of Ebola virus disease. In the upper left corner you will see fruit bats. As you will notice, they're larger than what you would expect a bat to be, and they're also used as game in Africa. Fruit bats range from very small to pretty large. They're known as a flying squirrel, and they're thought to be the natural reservoir for Ebola virus disease. And what usually happens is this fruit bat will eat the fruit, defecate in areas where other animals get food sources from, like the forest and stuff. And what will happen is it will infect other animals, and the animals that we have seen infected and part of the transmission cycle are non-human primates such as gorillas and chimpanzees, and also this little antelope looking animal. It's known as a duiker in Africa. And what will happen is people will kill these animals and use them for food. They're known as bush meat, and either from butchering the animal or from eating undercooked food, they will then ingest the meat or contaminate themselves with Ebola virus disease. They often do not understand that they are sick and need help. They will die, and then due to the cultural practices of the country, people bathe the body, which is highly infectious, and then infect other people. And that's usually how this infection starts out, and that's how it started out in this particular instance. Ebola virus transmission, what I want you to also understand is there are no cases currently in the United States. There are no cases of EVD in Kentucky. So the risk factors for EVD include residence in or travel to an area where EVD transmission is active. Also direct contact with the blood or body fluids of patients suspected to have EVD. Direct handling of bats, the fruit bats, the duikers and or the primates, chimpanzees, gorillas, from disease endemic areas. So also handling of bushmeat. Also the handling of a deceased person suspected of having EVD in preparation for funeral rites. The body is highly contagious at that time, and that's how it's thought to really start an outbreak. As far as ambulatory care settings go, and this would include local health departments, what we want you to know here at KDPH is that infection control is the key strategy in stopping the spread of Ebola. And the keys there are identifying and managing patients with Ebola virus disease. And that's what we're going to talk about today. Before we begin talking about the use of PPE and how to identify and isolate people with EVD, let me just say this. The risk of transmission of Ebola virus disease from patients to healthcare workers depends on several things. One is the risk of exposure to infectious blood or body fluids of a patient, and then also the likelihood that that patient has confirmed Ebola virus disease. And in the local health department setting, that risk is very, very low. Almost all febrile patients presenting to the ED or ambulatory care centers do not have EVD, and I'm going to go over that point again in a minute. Early symptoms of EVD are similar to other febrile illnesses. Therefore, what we want to talk to you about is how to triage and evaluate patients and how different processes should be put into place to protect you and others. Facilities should implement administrative and environmental controls to provide for on-site management and safe use of PPE. So the following training is based upon current CDC as well as OSHA guidelines on the use of PPE and how to triage patients. Now we're going to talk about EVD screening in the United States. Currently, there's a very low risk of EVD transmission or outbreak in the United States, as we do not have any cases. And also remember that airline passengers are screened for elevated body temperatures and other symptoms before leaving countries with ongoing outbreaks of EVD. The CDC is working with state health departments and ports of entry into the United States to prevent introduction of this disease into our country. All individuals returning from Ebola-affected countries must go through one of 5 airports that have been designated by the government. Since passengers from Ebola-affected countries are being screened and monitored by local and state health departments for 21 days after they arrive here, it's unlikely that patients with a positive travel history and exposure will present to local health departments. Also, I want to point out that it's very important that while you're monitoring these patients, that you explain to them, that you educate them, that if they become symptomatic, they are to call you so that you can notify the health department, the state health department, so that we can arrange transportation from their home directly to a hospital for further assessment. This is the CDC's poster that they put out that depicts an algorithm for health departments and other ambulatory care centers to use in screening patients, identifying and isolating them to protect you and other healthcare workers. I think this particular poster is very helpful. It explains that your role should mainly be one of identification, isolation, and then informing. So it's a very easy algorithm to understand. The first thing that you will want to do is you will want to ask people about their travel history. Have they been to Western Africa, to those countries that have been affected, and what symptoms they have. If the answer to both is positive, if they have symptoms and they have been to Western Africa or had an exposure where they've had contact with a confirmed Ebola virus disease patient, then you want to isolate them very quickly in a room, and then you want to call us so that we can assist you with transportation of that particular patient from the local health department to a hospital for further assessment and testing. So let's just look at identification of these patients. To identify, whenever they come into the local health department, you want to set into place a screening mechanism where you ask about their travel history and exposure history. So you want to ask them, have they traveled to and from a country with widespread EVD, and that would be the 4 countries that I mentioned. Or have they had contact with an individual that is confirmed to have had EVD in the previous 21 days. Then you want to ask them about symptoms that they have. Do they have fever, fatigue, headache, weakness, muscle pain, vomiting, diarrhea, abdominal pain, or hemorrhage, bleeding? Do they have bruises, petechiae, anything like that? Have they vomited blood? Do they have blood in their stool? After identification has been made, you want to isolate the patient immediately. So, if a patient has a positive travel history and exposure history with symptoms, and that's important, that's a very key thing, they're not contagious until they develop symptoms. You want to place the patient in a private area or room. You want to give them a private bathroom if possible, and avoid unnecessary direct contact. So if you need to go take the patient's temperature, be sure that you have a digital thermometer that you can throw away. You don't want to reuse that equipment. And you also want to be sure that if you have to have direct patient contact like this, that you don appropriate PPE, which we're going to cover. Staff members that have to don PPE should refrain from direct interaction with other staff until the PPE is removed. Doffing PPE, taking it off, should occur in a separate area as well so that it can be confined and you don't contaminate other environmental surfaces at the health department. Remember that only essential personnel with designated roles should evaluate the patient. This is not a time for other people to come in and talk to the patient. One person should be designated to do it, and they should have on appropriate PPE. If the patient is bleeding, vomiting, or has copious diarrhea, try not to re-enter the room. That is the time that you need to call EMS for transport to the hospital, as well as call us here at KDPH. Our number is 1-888-9-REPORT. We will assist in the arrangements for transportation from the health department to a hospital for further assessment and testing. We will also contact the CDC, and we will tell you how to handle different things such as cleaning up of your environment, etc. And you need to help prepare the patient for safe transport. Again, if they're vomiting or have diarrhea, we do not want you to go into the room. EMS will know how to handle that patient and how to pack them up for safe transport. You might ask, why is this important? It's to be prepared. Remember, there are specific syndromes involving diagnostic uncertainty. Ebola is one of those. Other examples are febrile illness, vomiting, diarrhea, norovirus can look like Ebola virus. And you encounter these routinely in ambulatory care settings where people seek assistance with illness, and you have to know how to triage them appropriately. So facilities should develop and implement systems that allow staff to identify early, isolate quickly, and inform timely. So we're going to talk about triage and the use of PPE in ambulatory care settings such as the health department. Remember that no one should have direct contact with a suspected EVD patient who is symptomatic without wearing appropriate PPE. Staff should be trained in proper donning and doffing of PPE. This is a time for you to use what we're presenting in this particular video and instructional unit. You should practice it time and time again so you know how to put it on and take it off. The use of PPE also requires knowledge and understanding of standard and transmission-based precautions, which I'm going to review quickly for you. Okay, understanding standard and transmission-based precautions is very important. Isolation precautions are used to reduce transmission of microorganisms in healthcare settings, and there are primarily two categories. You have standard precautions and you have transmission-based precautions. Transmission-based precautions were formerly known as isolation precautions. These are outlined in Healthcare Infection Control Practices Advisory Committee, also known as HICPAC. The last time that they were revised was in 2007, and I would look for a new revision to be made to the HICPAC guidelines for isolation precautions, especially in consideration of what we know about Ebola today. Standard precautions. Standard precautions are based upon the principle that all body fluids may be infectious when exposed to non-intact skin or mucous membranes. They apply to the care of all persons in all healthcare settings, regardless of the suspected or confirmed presence of an infectious agent. So just remember, if it's wet and it's not yours, you need to use standard precautions with gloves and gowns. Standard precautions always includes hand hygiene with the use of gloves and gown when appropriate. It can also include face shielding if splashing is anticipated. Examples of standard precautions include proper hand hygiene, safe injection practices, proper use of personal protective equipment, and proper care of the environment, textiles, and laundry. It also includes appropriate patient placement and appropriate waste disposal and management. As far as hand hygiene or hand washing is concerned, it is the foundation for standard precautions. Hand hygiene should be performed in the following situations: before touching a patient, after touching a patient or the patient's immediate environment, after contact with bodily fluids, excretions, or wound drainage, prior to performing an aseptic technique, if hands are moving from a contaminated area to a clean body area and you have gloves on, you want to take the gloves off, perform hand hygiene, and put new gloves back on. And hand hygiene is always performed after glove removal. This next slide is one of my favorite slides. It depicts hands that have been washed. It shows the areas that are frequently missed. If you look at the reddened areas, those are the ones most frequently missed. You'll note that it's the tips of the fingers and the thumbs. And those are areas that we tend not to get washed very thoroughly. We tend to wash our palms and the tops of our hands pretty well, and we can even get our wrists pretty well, but we forget our fingertips and our thumbs. So I just wanted to let you know about areas that we miss and what you can do to protect yourself. This is a slide on hand hygiene, and I've included it just to review the steps with hand hygiene. Of course, these particular pictures show hand hygiene performed with running water and soap. The technique actually for alcohol-based hand gel is the same, except you're not using running water. So first, with running water, you want to wet your hands, then you want to rub your hands together really well. Notice the technique here. You've laced your hands together and you keep rubbing between your fingers. You might also want to be sure that you put your fingers in the palm of your hand and scrub them like this. And you want to do it with both, and lace your fingers, tops, palms, your wrist like this, and then you want to rinse and then blot dry. You would do the same technique with alcohol-based hand gel. You just wet your hands with the hand gel, lace your fingers, get your fingertips, your thumbs, the tops of your hands, your palms, your wrists, and let it air dry. Okay. As far as wearing gloves, you want to wear with Ebola virus disease patients or those suspected of EVD, you want to wear just clean gloves non-sterile, but you want to be sure they're made of nitrile. They're thicker gloves and they afford you more protection. You want to wear gloves when touching blood, body fluids, secretions, excretions, and contaminated items, and before touching mucous membranes and non-intact skin. Now, that is what standard precaution says. In the Ebola virus disease patient, you want to wear gloves whenever you touch their skin or clothing at all. You want to change gloves between tasks and procedures on the same patient or after contact with material that may contain a high concentration of microorganisms. And this is where Ebola virus comes in. I also want to point out, I put a picture here of nitrile gloves, and they come in different colors, but these have extended cuffs. And I think you can usually order 12-inch extended cuffs for the gloves, but you want to be sure they come up on the wrist more than just regular isolation gloves. Then with use of a face mask and face shield. You always want to wear a face mask and face shield to protect the mucous membranes of the eyes, nose, and mouth. So those would be during activities that you might anticipate splashes or sprays of blood or body fluids, secretions, and excretions. And just always protect your eyes and protect your mouth and protect your nose, because people can cough and have droplets too, especially with Ebola virus disease, and you want to be sure that your mucous membranes, eyes, and mouth are protected. Standard precautions also includes the use of a gown. So you would wear a gown during procedures and patient care activities that are likely to generate splashes of blood, body fluids, secretions, or excretions. Now remember, I'm reviewing just what standard precautions are, but in the case of an Ebola virus disease patient or one that is suspected of having EVD, you always want to wear a gown, whether you anticipate exposure to blood or body fluids or splashes. You want to make sure that your gown is impervious. So when we talk about a fully impervious gown, it should be impervious from neck to hem. All the sleeves should be impervious, and the back of the gown should be impervious. So what we have found by doing research at KDPH is that surgical gowns are your probably best source for an impervious gown. You just have to make sure that it is impervious all over the gown. And if you read about the different surgical gowns, you will see that it has different regions. They're known as A, B, C, and D. You want all of those regions to be impervious. Some of the surgical gowns only have A, B, and C, which is the front of the gown and the sleeves. And you want to be sure it includes D, which is the back of the gown as well. When you use a gown, you want to remove the soiled gown as soon as possible and wash your hands. Now we're going to talk a little bit about transmission-based precautions. As I told you, they were formerly known as isolation precautions. You use these precautions in conjunction with standard precautions. They are used for any patient who is known to be or suspected of being infected or colonized with an infectious agent. That includes pathogens that require additional control measures to prevent transmission. Basically, there's three types of transmission-based precautions. Those are contact precautions, droplet precautions, and airborne precautions. Always remember that you use standard precautions in addition to standard-based precautions. The first one we're going to talk about is contact precautions. Contact transmission risk requires the use of contact precautions to prevent infections that are spread by either direct contact or indirect contact. Direct contact, we're talking about from person to person. Indirect, we're talking about being carried from another person to a third party or from a contaminated object. Use standard precautions in addition to contact precautions for patients that are known or suspected to be infected or colonized with important microorganisms. So it's used for patients that have infections that can be spread by contact with a person's skin, mucous membranes, feces, vomit, urine, wound drainage, or other body fluids, or contact with the environment or environmental surfaces. And some of you may have a lot of experience with contact precautions, and some of you may not. So I've included some pictures. It isn't specific to Ebola, it's specific to anybody who has contact precautions. So what patients would we see in contact precautions? We would see all those patients that have a possible multi-drug resistant infection, like MRSA, and that is the one that I've chosen to show you pictures of. We always put patients who have MRSA infections in contact precautions. It's also used with lice and scabies, with RSV, with any draining wound where we don't know what the organism is, and with Ebola virus disease. What you need gel, gloves, hand hygiene, and with Ebola virus disease, you need a gown. If any wound is draining, you need a gown. Placement is always in a private room, and that is to prevent contact or transmission with another patient. Transmission precautions are not enough. The second one is droplet precautions. Respiratory droplets transmit infections directly from the respiratory tract to an infected individual to a susceptible individual. And usually when you think of droplet precautions, think of coughing or sneezing. That's how it's transmitted. So droplet precautions are used for patients that have an infection that can be spread through close respiratory or mucous membrane contact. I've given you a little bit more information. You may say, well, who would that be? In addition to Ebola, because it's also recommends, the CDC recommends droplet precautions, we would use that with people that have possible influenza, meningitis, talking about bacterial meningitis here, rhinovirus as well. What to do, you use gel, gloves, and a regular mask, and the patient placement is in a private room. Again, remember, standard precautions are not enough. So you do standard precautions in addition to the droplet precautions. I'm going to talk a little bit about airborne precautions. And I'm not going to go into great depth because airborne precautions requires a great deal of understanding and knowledge and part of a respiratory care program. But I am going to highlight it because one of the recommendations with CDC is that healthcare people taking care of an Ebola virus disease patient use an N95 mask or PAPR. So I just wanted to include some information on airborne precautions here. That is not recommended for people in ambulatory care settings, such as the local health department. But I wanted you all to just review the concepts behind airborne precautions a little bit. Airborne precautions are intended to prevent the transmission of organisms that remain infectious when suspended in the air. And there are two types, and I think this is the easiest way to understand it. One is acid-fast bacillus, or TB, and the other one is non-AFB. And under non-AFB, we have varicella zoster, or chickenpox, or disseminated zoster, and we have measles. In addition to standard precautions, airborne precautions require the use of two things. One is the use of a fit-tested, NIOSH-approved N95 mask or a high-level respirator when entering the room of anybody that's suspected to have an airborne infectious disease. Another thing is patient placement. It always requires the placement of a patient in a negative pressure room. And you also have to look at things like patient transport, personnel restrictions, and exposure management, depending on what disease you're talking about. With airborne precautions, non-AFB, I've outlined a little slide here, and I'll explain different things as I go. Non-AFB airborne precautions are used with patients that have an infection that can be spread over long distance. Examples are people with chickenpox, measles, or disseminated zoster. You need gel, gloves, hand hygiene. The patient needs to be put in a negative pressure room. And the reason that they're always put in a negative pressure room is to protect the transmission of this particular germ to patients or visitors who've not had immunization against these diseases. Standard precautions are not enough. If you as a healthcare worker are not immune to chickenpox or measles, you probably should not be giving care to this patient, and you need to go to employee health. You do not need to wear a mask, an N95 mask or a PAPR when providing care to these patients if you have had the vaccine or have had a history of having measles or chickenpox. If you're not immune, you must wear an N95 mask or a PAPR. Always remember that if you are not sure of your immune status to these diseases, you can always choose to wear an N95 mask or a PAPR. But once you put that mask on, or you need that mask, you always have to be part of a respiratory care program, and I'm going to explain that in a minute. Airborne precautions with AFB or TB, things that you have to remember about it is that not only do you have to do hand hygiene and wear gloves, but you always have to wear a mask that protects you. And that would be your N95 mask or your PAPR, and they always have to be put in a negative pressure room. Standard precautions are not enough. These are some pictures that I have put up so that you can see what an N95 mask looks like, and you can see there's different kinds. That is why you have to be fit tested. You may not be able to wear one, but you may be able to wear another. One thing I do want to point out is once you've been fit tested, you should always know the brand of the mask that you were fit tested for, because there could be differences in those masks, but there are different types. And when you undergo fit testing, they will tell you which type is best. It's a fairly in-depth process, and you really can't take care of patients in negative pressure rooms that have TB without being fit tested. You can't take care of patients that are in negative pressure rooms that have chickenpox or measles or disseminated zoster if you don't have an immune status to chickenpox or measles without being fit tested for one of these masks. Here is a PAPR. If you cannot be fit tested, and some people cannot be, we can't get a good seal around their mouth, their cheeks, then you have to wear a PAPR. Another thing is that with the use of these masks, men who have beards, you can't get a good seal, so they always have to wear a PAPR. This is something I want to call your attention to. With airborne precautions, the use of the N95 or PAPR, your employer has to set up a respiratory protection program under this particular guideline. And so what it basically says is that that institution must have a written program. They must have work site specific procedures. Other elements of this respiratory protection program include training on how to use the mask or PAPRs, fit testing, medical evaluation, care and maintenance, procedures for respiratory selection, and procedures for routine and emergency use. I have gone over airborne protection not because you need it, but because there are lots of questions. Do I need to use an N95 mask? And the answer is no, you do not need to use it. It is part of the standard PPE when you're taking care of a very sick patient with Ebola virus disease, but not when you're seeing a patient in an ambulatory care setting, because remember, your role is to identify, isolate, and inform, not to really provide a lot of direct care. This is a helpful slide which outlines the different types of precaution. It begins with standard and then moves up contact, droplet, and airborne precautions, and you can read over that. It's just a handy little chart to see. One thing I want to call to your attention, again, and I'm focusing on this because there's been so many questions about these N95 masks and PAPRs. Airborne precautions for healthcare personnel providing direct care to confirmed or suspected EVD patients who are symptomatic. Those recommendations do include the use of an N95 respirator or PAPR. This virus is not spread through the air, but because they can cough and have the virus in any of their droplets, they want you to use an N95 when providing direct care to very sick patients. This does not usually include the ambulatory care settings such as local health departments. This is reserved for the EMS personnel and for hospitals. However, if you have been fit tested to an N95 mask and you want to use an N95 mask, that is fine. But your fit testing has to be annual because you can gain or lose weight, and you have to be sure you have proper testing and that you've had medical evaluation. The current CDC guidelines in the care of EVD patients calls for standard, contact, and droplet precautions with the use of respiratory protection, not airborne precautions, but respiratory protection with the use of an N95 or PAPR. So again, I want to reinforce your role in the ambulatory care setting. Do you need airborne transmission precautions? And the answer is no. The CDC recommends that people in ambulatory care settings do not provide direct care to patients with suspected or confirmed EVD that are symptomatic. They should be transferred to the hospital for further assessment and testing. Your role in an ambulatory care setting is that of isolation, identification, and informing. Some points to consider when working in transmission-based precautions. You want to minimize the amount of entrances into the room. Only one person really should go into that room. You want to minimize the amount of people in the room. Like I said, one person. PPE should be put on before entering the room, and it should be removed in a manner that will prevent self-contamination. Normally, PPE is removed inside a room before you leave and discarded in a receptacle inside the room or in an anteroom right outside the room. With Ebola virus disease, PPE is always removed outside the room so that you don't contaminate your clothing, and it should be removed in a private area that you have designated for PPE removal, close to exiting the room. So in summary, these are the minimal expectations for safe care to manage a patient with suspected Ebola virus disease in outpatient settings. Now remember, we're talking about symptomatic patients here. Facilities should be able to identify that patient early, isolate them quickly, and inform timely. You want to adhere to strict standard contact and droplet precautions. You do not need airborne precautions. You want to perform meticulous hand hygiene, and you want to ensure detailed environmental cleaning. We will advise you how to clean the environment if and when this situation arises. It's beyond the scope of this particular presentation to cover environmental cleaning within a health department. The next thing we're going to talk about is we're actually going to get into showing you how to don and doff PPE. Principles of PPE. Staff should understand the following basic principles to ensure safe and effective PPE use. First, decide what type of PPE is appropriate. Now, this is important because some health departments have said they are going to use coveralls, and that's perfectly fine. I believe that gowns are easier to get in and out of, but if you all are comfortable with coveralls, that is perfectly fine. You need to know how to don the appropriate PPE, and you need to know how to safely take it off. And I think it's very easy to remember what you can touch and can't touch if you just remember what's clean and what's dirty. So with PPE, what is clean is the back of the gown, the inside of the gown, the inside of the gloves, and the straps on the back of your head, of your face mask or your face shield. What's dirty is always the front of your gown, the outside of the gown, the outside of the gloves, the front of the face mask, and the front of the face shield. So that tells you where you can or can't touch. Bare hands or hands with inner gloves should never touch anything dirty. And that has always been the easiest way for me to teach donning and doffing PPE, is if you can remember those principles, then you always know what you can and cannot touch. PPE required for ambulatory care settings. in assessment of patients at risk for EVD include these things: an impermeable gown. Remember what I told you about an impermeable gown. Gowns have zones A, B, C, and D. When you are looking at caring for an Ebola virus disease patient in an ambulatory care setting, it should be impervious in all those areas, A, B, C, and D. A mask. It does not have to be an N95. A face shield. 2 pairs of gloves with extended cuffs, and an impermeable boot covers extending to mid-calf. This is something we have added to our previous webinar about PPE. This came out about the same time that we did the first one, and the boot covers were included, so we have revised this particular presentation to include the boot covers, to show you when to put them on, how to put them on, and how to take them off. You might also remember that as we go through the presentation, while you will only wear 2 pair of gloves at one time, you will need a 3rd pair in the area where you're taking off your PPE. So I wanted to alert you to that before we get started. The sequence for donning PPE. The first thing you put on are your boot covers extending to mid-calf. Then you put on the first pair of gloves, and you want to be sure that they go up on the wrist. Then your gown, your face mask, your face shield, and your 2nd pair of gloves. Remember, the combination of PPE affects the sequence. So coveralls won't affect you all if you decide to use those. You will see some people put on boot covers inside the coveralls, and some people put on outside the coveralls. If you decided to put it on outside the coveralls, then you would put that on last, or right before you put on your 2nd pair of gloves. And if you have questions about that, you can always call me or Shelly, and we can walk you through it. Preparation for donning PPE. First is gather your appropriate PPE. You want to perform hand hygiene, and you must have a trained observer available prior to putting on PPE and whenever you take it off. And this is part of the new guidelines from the CDC. It is very hard to remember all the steps to prevent self-contamination, so CDC recommendations include the use of a trained observer. And when I get through with the presentation, Shelly and I are going to demonstrate how to put on PPE and how to take it off. And I will act as the trained observer, and I have a checklist in front of me, and Shelly, of course, will be the one donning and doffing PPE. That is crucial. You must have it. So you cannot start putting on PPE or taking it off without the trained observer being present, watching you and reminding you of the different steps. So the first thing you want to do is you want to don your boot covers. And boot covers should extend to the mid-calf, really quite up almost to the knee. Sit down in a chair. You should probably have 2 chairs. The CDC, if you look at their site, they have 2 chairs. One's labeled clean and one's labeled dirty. And that's probably the safest thing. So the clean chair is where you sit in your garments when you first start putting on your PPE. And you need to sit down when you put your boot covers on. Put the boot covers on in such a way to make sure that all areas of the foot are covered and that the boot covers are snug and over your ankle and calf. When you get through putting on your boot covers, the very next thing you do is perform hand hygiene with an alcohol-based gel. Then you want to don your first pair of gloves. Your first pair of gloves, remember, these should be nitrile gloves. They're thicker and they should have an extended cuff. So I have included 2 different pictures. The first picture shows that you should push the cuff of the glove up the arm. Now you will notice that that particular drawing has a gown in it. You will put your first pair of gloves on before the gown. And I've included a picture down below to show you that that goes on first before you put your gown on. This picture at the bottom also shows the extended cuffs. So you want to insert your hands into the gloves in such a fashion that your wrist of the gown will cover the cuff once you put your gown on. You want to pull the extended cuff of the gloves up on the arms to be sure your skin is covered. Then the next thing you want to do is don a gown, or if you choose to use your coveralls at this point. You want to select the appropriate size and type, make sure it's fluid impervious. The opening should be in the back. Actually, it's best if it overlaps and it kind of opens to the side. Secure it at the neck and the waist. If the gown is too small, then use 2 gowns. Gown number 1 ties in the front and gown number 2 ties in the back. But most of the impervious surgical gowns come in XXL, and I would recommend that you order that for anybody that might need it, because there should always be enough room to move in the gown without exposing your garments. Then the next thing you want to do is don a mask. Remember, in the ambulatory care setting, you do not need an N95 respirator or PAPR. If you have been fit tested and choose to use that, then you may do so. But in donning a mask, you want to place the mask over the nose, chin, and mouth. You want to fit the flexible nose piece over the bridge of the nose. You want to secure the mask on your head with ties or elastic, however it may come, and then adjust to fit. You want to be sure you're comfortable. You want to be sure that this mask covers your nose and that it goes up under the chin. And you want to make sure the ties are here on the head, and this is at the crown of the head. If you choose to use an N95 respirator, and we're going to use that in our demonstration, you want to select a fit tested respirator, an N95, one that you've been fit tested for, and a PAPR. You want to place it over the nose, mouth, and chin. You want to fit the flexible nose piece over the nose bridge, secure on the head with elastic, adjust to fit. Now, you also want to be sure that you perform a fit test. This is always mandatory when using an N95. And you inhale, and you should feel the respirator collapse around your fingers a little bit. And then you want to exhale, and you should check for leakage around the face. If it doesn't collapse or there's leakage around the face, it's not properly fitting you. Again, you do not need an N95 mask in the ambulatory care setting. But if you choose to use one, make sure that you are properly fit tested, that you've undergone medical evaluation to be sure you can use it, and that you know how to use it properly. Then the next thing you want to don is a face shield. And you want to position the face shield over the face and secure it on the brow with the headband. And then you want to adjust it to fit comfortably. And you'll see Shelley do this in our demonstration. The very last thing you want to do is don your second pair of gloves. And you don them in the exact same fashion that you did your first pair. You know, when you insert your hands into the gloves, you want to be sure that you pull the gloves, the extended cuffs, over the cuff of the gown. So in this particular, in the upper right hand corner, you can see how it should look when it is on. And the cuff of the glove goes well over the cuff of the gown, and that is what you want for properly securing, properly fitting pair of gloves. I will point out that it is helpful when you're ordering gloves to order different colors of these gloves. You don't have to, it's not really recommended or required, but if you have 2 pairs of gloves, if the outer pair should tear, that is more visible to you than if you have both gloves being the same color. And Shelley will use 2 different colors in her demonstration. Then you're ready to go in and provide care to the patient or assess the patient. In providing care to the patient, some things to think about with PPE. Always keep your gloved hands away from your face and don't adjust or touch your PPE. Remove your gloves if they become torn. Perform hand hygiene before donning new gloves. So you always want to have gloves available to you to put on, even if somebody has to bring them to the door to you, if your gloves should tear. Limit surfaces and items touched. You don't want to be touching a whole lot. Once you have used and provided care to the patient and you're coming outside the room, you need to know how to remove PPE safely. So again, just remember what is dirty and what is clean. Your contaminated area is the outside and the front. These are the areas of your PPE that are most likely to have been contaminated with any microorganisms. What's clean is the inside, the outside back, and the ties on the head and the back. So just remember, you can touch the back area, you can touch the inside area of gowns and gloves, but you can't touch the outside areas. Now when we talk about touch, we're talking about with bare hands or your inner gloves, not your outer gloves. But of course you don't want to touch your clean area with the outer gloves because then you contaminate it. So your sequence for removing PPE is the first thing you will remove are your boot covers, then your first pair of gloves, then your face shield, then your gown, then your second pair of gloves, and then your mask. You want to remove the PPE just outside of the patient's room in a very confined private area. You don't want it to be an area where staff move through it until after it's cleaned. So think about that when planning for seeing somebody who might have Ebola virus disease. You want to have clean and dirty chairs readily available outside the door. And that will make more sense to you after we start demonstrating it. You want to ensure that hand hygiene facilities are available at the point needed. So that would mean you want to be sure you have an alcohol-based hand rub available to the person as they start removing the PPE. Because some of the things that the CDC recommended is that not only do you have a trained observer to watch you and sometimes even help you, but you also wash your gloved hands using an alcohol-based hand gel after each removal step. You want to have a waste receptacle equipped with double bags for discarding the PPE. So, in preparing for doffing PPE, prior to exiting the room, you want to perform hand hygiene inside the room with an alcohol-based hand gel on the outer gloved hands and allow it to air dry because you don't want to contaminate things coming out of the room. You must also be sure that the trained observer is present and ready to watch you remove the PPE. Before the trained observer before you start disrobing, you should be sure that the observer checks your PPE for any kind of tears or any kind of gross contamination that you're not aware of, so that extra care can be given. Now, I've put a picture here, and of course they have a hood on, but you don't need a hood, but everything else is fine. You want to be sure that they look you over front and back so that you, again, can identify any areas. If by chance the patient was vomiting and it splashed upon you, we want to look to see what areas have been contaminated. The next thing is you want to sit down in a chair. You don't want to sit down in the clean chair. You want to sit down in the chair that you have reserved as your dirty chair, okay? You want to be careful not to touch one leg with the other, so don't cross your legs when you're removing it. You want to grasp the outside of the boot cover and pull down toward the ankle. Then lift the boot cover over your heel and pull it off your foot. Do not touch the bottom of your shoe. Dispose of it properly. Repeat the process for the other foot. Then you want to wash your hands before you go any further with an alcohol-based hand gel. Forgive me that I didn't include that on your slide before we began. Then after you air dry, you want to remove your outer gloves. And you remove them by grasping the edge near the wrist. Okay, you want to peel it away from the hand and hold the glove that you've removed in this opposite hand. Then you want to take your finger. Now this drawing has bare hands, but remember you're going to have an inner glove on, and you want to slide your finger under the wrist of the remaining glove and peel it from the inside, creating a bag for both gloves. You want to discard. Then you want to perform hand hygiene with an alcohol-based hand gel on the inner gloves of both hands. Now you're ready to proceed to remove your face shield. You grasp your head pieces or the head strap with your hands, and they have the inner gloves on them. Okay, so you can do it from the side, and then you lift it away from the face. It helps if you bend forward a little bit, and Shelley will demonstrate that for you. You want to place it in a designated receptacle for disposal. After you remove it, you want to perform hand hygiene again. Your hands will have the inner gloves on them, and use an alcohol-based hand gel. Allow to air dry. Then you want to remove your isolation gown. Unfasten your tie first at the neck, then the waist. You want to peel the gown away from the neck and shoulder. As you do, you want to turn the gown inside out. You want to roll it toward the inside, fold and roll into a bundle. You do not want to shake the gown, move the gown, disturb it very much, because you don't want to aerosolize any type of microorganism that could be on that gown. Then you want to discard, and you want to perform hand hygiene with the gel on the inner gloves of your both hands. Then, this is different, you want to change the inner pair of gloves. And I think the reason will become more clear as we move on. So you've already disinfected that initial pair of inner gloves. You're going to remove them. Then you remove them the same way that you did the outer pair. You know, you remove from the wrist, and then hold in the opposite hand, and then discard. And then you want to put your new gloves on. And you put these new gloves on before you remove your face mask. Okay? You remove your face mask from the back, not from the front. It is very tempting to grasp the face mask from the front and remove it, but do not do so. You want to remove it from the back. You want to discard, and you want to perform hand hygiene again with the alcohol-based hand gel on inner gloves of both hands. Then if you're removing an N95 respirator instead of just a regular face mask, you remove it without touching the front of the mask. You lift the bottom elastic over your head first, and that is what is different about removing an N95 than a regular face mask. Then lift off the top elastic, okay? Then discard, perform hand hygiene. Now, the next thing that you're going to do, you've worn boot covers, and you've worn boot covers to protect your shoes. So you have to disinfect your shoes now. So what you will need is you will need to be sure that you have an EPA registered disinfectant wipe to use on all the surfaces of your shoes. So the first thing you want to do is sit down in a clean chair, and then so you move from the dirty chair to the clean chair. And the reason that you do that is, remember, you're sitting in the dirty chair initially to remove your boot covers, and you have your gown on. By this time you do not have your gown on, you have your regular clothes on. So now you have to sit in a clean chair, because otherwise you will contaminate your clothing. So you sit down in a clean chair. Once you're sitting down, use a wipe to wipe your shoes. Begin at the top, do the sides, and then do the soles. And so here you can see on this particular photograph, they've cleaned the top, they've now moved to the sides, and then the bottom's the last part. Don't touch your ankles. Be very careful. After you are finished, you want to perform hand hygiene on your inner gloved hands. Then you want to take the gloves off the same way we've reviewed and discard them. Then you want to perform hand hygiene again immediately after removing the gloves and all your PPE. You can choose to do so now with soap and water, or you can do it with an alcohol-based hand gel. Please remember, when you're preparing for taking care of somebody or seeing somebody that might have EVD, you want to be sure that a sink with soap and water is easily available to somebody that has to go in that room and put on PPE and take it off, or that you have alcohol-based hand rub easily available. Key points about PPE. You want to don the PPE before contact with the patient, before entering the room. You want to use PPE carefully. You want to remove and discard PPE carefully, either at the doorway or immediately outside the patient room. Remove the respirator outside the patient's room. You always want to treat medical waste appropriately. I've told you to double bag. And then if this patient is somebody that we have determined needs to be sent to a hospital for further evaluation and possible treatment, then you need to be able to secure that waste until we determine whether or not that patient is positive for Ebola virus disease. So you need to think about that in your preparedness plans. You want to immediately perform hand hygiene after the use of PPE. So those are some key points to think about in your planning. Final thoughts. Remember that PPE is available to protect you from exposure to infectious agents in the workplace. You should know what type of PPE is necessary for the duties you perform and how to use it correctly, and you should practice it. That has been one of the things, several things came out of all that happened with the Ebola virus disease patient in Texas. One is that we learned how valuable the trained observer was in preventing contamination of the person removing PPE and even putting it on. We also understood how important it was that you practice with the PPE that you know, and that you don't try to use PPE for the first time with an EVD patient. So that concludes our presentation. I have included this particular website. It has a poster that was referred to in the CDC guideline for ambulatory care centers. It actually has a poster on how to remove PPE. Because we have added the shoe covers, the boot covers, you will find that it does not have that in there. So you could, if you use that poster to help remind people, then you should put it in the appropriate place, write it in and post it where everybody can see it. And it may not be that helpful to you after OSHA came out with their guidelines with the boot covers. That concludes this portion of our presentation. In the next segment, we will practice putting on PPE and taking it off. However, I've provided our contact information, and if you have any questions, please do not hesitate to call Shelley or myself. Thank you so much. Hello, I'm Lynn Roser. Welcome back to the second portion of our presentation on donning and doffing PPE. This is Shelley Wood, my co-presenter in this presentation. I will be serving the role as the trained observer, utilizing a checklist for helping Shelley put on the PPE and taking it off. Shelley will be in the role of the person actually putting on PPE. I hope you'll be able to see all the fine points of putting on the gloves, putting on the boot covers, and taking them off. We'll try to position where you can see everything. Okay, so we're going to begin. As I told you before, I'll be utilizing a checklist. The checklist is very important. We have prepared this for your use, so when you watch this presentation, please look over the checklist and watch us as we go through. You will need the checklist for putting on the PPE as well as taking off the PPE. The trained observer can also function as a resource to the person putting on PPE by helping them putting it on and taking it off. Okay, so we're going to go on and begin. The first thing that Shelley is going to do is she's going to do as any nurse would do, remove her jewelry, put her hair up, prepare to get into the PPE. She's also going to gather her PPE. So we're going to do that right now. Shelley is taking off jewelry. Now Shelley has taken off her jewelry and she's now going to put up her hair. And the reason you want to put up your hair or tie it back is because you'll be putting on a face shield and you want to be able to protect your face, and you don't want your hair in your face where you will be tempted to try to push it out of the way. Okay, great, Shelley. All right, the next thing we're going to do is Shelley has gathered her PPE, and we're going to go through it with the trained observer just to be sure she has everything. So she's got 2 pair of gloves. Actually, she has 3 pair of gloves.
Actually, I have 2. I'll get the other one.
Okay, and she has a face mask. She's going to use an N95 respirator. She has a face shield. Okay. She has her boot covers. Excellent. And she has her impervious gown. You will also notice that we have a gel dispenser right here. Okay, so Shelley is going to begin putting on her PPE, and I'm going to utilize the checklist. So the first thing she will do is now perform hand hygiene, which she has done. Then she will take a seat in a clean chair and put on her boot covers. As she puts on her boot covers, please note that she's rolling them down, pulling them up to her knees. Excellent, very good. Now Shelley's going to stand up. The boot covers are fitting appropriately, tight around the ankles and tight right up under the knees to keep them up so that she has full protection of her calves and her shoes. The next thing she will do is put on her inner gloves. Now you will notice that Shelley is going to be using 2 different color of gloves. In the first half of the presentation I told you some people will do this. This is so that if the outer glove tears, the color on the inner glove is different and they can see a tear more easily. Excellent. And she's extended them up her wrist. The next thing she's going to do is put on her fluid impervious gown. And I will help her with this. You want to be sure that the gown is tied well in the back and covers her up. You want to tie it at the side. And you want to tie it in a bow-like fashion so that it can easily be untied. Very good. So you can see that this side is done. Shelley, turn around and let them see your back. You can see her whole back is covered. It's not gaping open or anything. It's excellent. And the camera will go back a little so you can see the length of the gown. All right, you want to turn around? And you can see that it's well down below her knees, mid-calf. Excellent. And you can see that the cuff of her gown actually covers her gloves very well, and that's what you want. Okay, so she can resume putting on her PPE. The next thing she wants to do is put on her mask. And this is an N95 mask, and Shelley does an excellent job at demonstrating the correct way to do this. You'll notice she's putting the lower strap at the back of her head, the lower back, and the upper strap at the crown of her head. She's adjusting the nose piece. If you use an N95 respirator, which you're not required to do, a surgical mask is fine. You do the same type of fitting, but you don't have to do a fit test. If you use an N95, remember you have to be part of a respiratory protection program, either through the health department or through a hospital, and you have to be fit tested annually. Shelley will perform a fit check because she is using it, and that is where she will breathe in, and you should see part of the mask collapse. And then she'll breathe out, and she's checking for air leakage around the mask. Very good. Everything was a go, Shelley, I assume, right? Next, she will put on her face shield. Notice how Shelley is doing it. She's got it on perfectly. She's adjusted the front of it. You can see it covers her face. You do not need to use a hood in your particular role in the health department. The next thing she will do is put on her outer gloves. And this sometimes requires the help of the trained observer, although Shelley is quite adept at this. So you want to make sure that these gloves, the wrist of the gloves, are up on the gown, which Shelley's are. You can see they're very good. Now, the very last thing that the trained observer needs to do with the person that has donned is she wants the person to just stand there and then turn around to inspect to make sure everything is covered. And it is. You know, her boot covers are on right, her gown is correct, her gloves are correct, her face mask and face shield are correct. So everything is a go. So Shelley, you are free to do patient care right now. Okay, now we're going to demonstrate how to remove PPE. Shelley has been in the room with the patient that's suspected of having Ebola that they're working up. So before she comes out of the room, you know, I'm either standing there, the trained observer is either standing there waiting, but she gets my attention to let me know she's going to need me. Now, what I can do while she is in the room is being sure I set up the environment correctly for her to start disrobing. What she needs to do is have a dirty chair and a clean chair, and I'll demonstrate why she has to have it. You can't, our set is small, so you can't see everything till we utilize them. But take my word for it, we have a clean chair and a dirty chair. Okay, so she gets my attention, and the very first thing that we're going to do is look at Shelley. I want to see if there's any breaches of PPE. So I'm going to look at her gloves, her gown, her boot covers, and everything looks great. So she can start taking off her PPE. Now, the best thing to do is have your hand hygiene dispenser right there. And you can either use one like I am using where it's portable and I help with the hand hygiene in addition to utilizing the checklist, or you can have one that is freestanding. Okay, so the first thing we're going to do is disinfect the gloves. Okay? Very good. So she's disinfected her gloves. Okay, now the next thing she's going to do is sit down in the chair and remove her boot covers. Now you can see that Shelley is removing her boot covers by rolling them down. She's not touching the sole of her shoe. Excellent. Very good. And she is discarding it in her waste receptacle. Very good. The next thing she's going to do is disinfect her outer gloves and then remove them. Again, this is why this checklist is so important. She's going to remove them like what I told you in the first part of the presentation, where she actually grasped the outer part, then the inner part of the opposite gloved hand, and she's going to throw them away. Excellent, very good. The next thing she's going to do is disinfect her inner gloves. Remember, you disinfect before you remove each piece of PPE. Okay, very good. So she's going to remove her face shield next. Now Shelley will bend her head forward, grasp her from the back, and remove it. And she will discard it. Excellent. Then the next thing she's going to do is disinfect her inner gloves again. Very good. Now the next thing, Shelley, that we're going to do is remove your gown. And I can help you with this. I will unfasten it here, okay, and Shelley can usually unfasten it from the side. Excellent. Now what she has to be very careful is she doesn't touch the front of the gown. Remember the back and the inside. So do you want me to help you with that? She's touching the back part of the shoulder, the inside. Very good. Rolling it inside. She wants to be sure that she doesn't aerosolize anything. She's done a great job. Excellent. She's rolling it up. And now she will discard it. So we look at her inner gloves again. And she's going to disinfect. And now she is going to take off her inner gloves. She will disinfect her hands. And I have her third pair of gloves right here. And she is going to put those on. And you might say, well, why do you need a third pair of gloves? Well, you need the third pair of gloves because the last thing that you're going to do is disinfect your shoes. Okay, so the next thing that you do, she's put on a new pair of gloves. She's going to take off her face mask. Okay, and she's going to disinfect her inner glove. Okay, very good. Now, Shelley, we're going to trade places, and you're going to sit in a clean chair, and you are going to clean your shoes. So, Shelley, we have changed places, and the reason that we changed places is that is where the clean chair is. And because she is completely disrobed now, she doesn't want to contaminate her garments with something that could be on the dirty chair. So I have the shoe wipes here, and I'm going to give her a shoe wipe. She will disinfect her shoes, top to bottom. Including the soles. If she needs another one, that's fine too. Now, the next thing she's going to do is disinfect her hands. And remove the inner gloves. Okay, then she will disinfect her hands again for a last time. So Shelley has completely doffed her PPE, taken it off. She's utilized good technique, but I'm going to visually inspect her one last time. So the camera will pan out so that you can see how I'm doing this. Shelley will stand there and let me look at her to be sure I don't see anything on her. She'll turn around. Everything looks fine. So Shelley, at this point, it looks like everything was great. There was no breach of PPE. You've utilized good technique. You are free to move about the health department and be with other people at this point. Now you'll notice you have a trash receptacle. This has to be double bagged, and your waste has to be kept in a place that is safe, like any medical waste. And then if the patient is transferred to a hospital to be worked up for the potential of having Ebola, you want to keep that trash until we can get back with you and give you the results of that patient's test. If they are positive for Ebola, then the medical waste has to be disposed of in another manner. It is beyond the scope of this particular video presentation to cover that, but we will deal with each health department on an individual basis. So if you have any questions, please feel free to call Shelley or I, either one. Shelley is a hazmat nurse that works in an ED department as well, very experienced with PPE, and I'm an infection control nurse. So feel free to call us at any point in time if you have any questions. Also, remember, we discourage you from actually providing direct patient care. Your job is really to identify, isolate, and inform, and that is what we want you to do. Try not to be touching the patient at all. If you take a temperature with the patient, which I can understand why you would want to do that, be sure you're using a disposable thermometer. Disposable digital thermometers are what the CDC recommends. So if you have any questions, please don't hesitate to call us. I thank you for your attention and have a nice day.